I could try for 8 hours. All right, we are live. Hello, welcome everybody, YouTubers, Google Plusers, Facebookers. This is our second Western Bariatric Google Live Hangout. My name is Paul Fraire. I'm the dietitian here with Western Bariatric in San Bernardino. So welcome. So I was trying to think of a topic today to start us off. But I guess I'll start off by introducing myself. I guess that's more appropriate. And then we'll get to answering questions and stuff like that. So feel free to type in, and we'll try to reach all your questions if we can figure this thing out. So, like I said, my name is Paul Fraire. I'm a registered dietitian in California. My background, I have a bachelor's degree in science of food nutrition from Cal Poly Pomona. I've done my internship. I've been a dietitian for about 6 years now. 87, losing count. My specialty is weight loss. I've been trained level 1 and level 2 for weight loss counseling, so that is my specialty. I also work in St. Bernardine's Medical Center as a clinical dietitian, as well as in bariatrics, as many of our patients know. I think most of our patients are going to be looking at this broadcast. So that's my background. Now let's get to the topic. So I was having a hard time thinking about a topic, but it just kind of came to me in a news story. So many of you may have seen this news story before. I think it came out on Monday, all over the place. I saw it on NPR, it's kind of like CNN. Another study, nutrition study, effects of low carbohydrate to low fat diets. So many of these have been done before. This is the latest one, and this one is for some reason getting more press than the previous ones in the past. So let's talk about it a little bit because it's pretty interesting, especially when you're trying to lose weight. So they pretty much in the study, by the way, if you want to look it up, it's from the Annals of, let's find this out, Annals of Internal Medicine. You can look that up. It's for free. You can print out the whole thing for free. And it's funded by NIH, which they publish all their stuff for free online. So you can look that up. It's called The Effects of Low Carbohydrate and Low Fat Diets. Pretty much, this study took two groups. One of the group, they fed a low carb diet. I'll explain what that is in a second, because low carb can mean a number of different things to different people. The second group was fed a low fat diet. I believe they were followed for about 12 months to a year. So you got low carb diet, low fat diet, and they were fed the same amount of calories. So what were the effects after a year? Turns out the low-carb diet people lost more weight, despite having the same amount of calories as a low-fat diet group. So we could explain why that is a little bit. But even more interesting than the weight loss is the effects on heart health. And this has been seen in the past, too. Triglycerides were lowered. Bad cholesterol, LDL cholesterol, was lowered in the low-carbohydrate group. HDL was higher. That's good cholesterol. And something else too that I can't remember. But anyways, very interesting. Same amount of calories, different effects. So that's really the point I'm trying to get to. A calorie is not just a calorie. It depends on the type of calorie. And they say this over and over again. So it really depends on what type of calorie you're eating, especially for those out there counting your calories. I always recommend to count the right types of calories, and that is always protein, and then follow your carbs and minimize that. So low carbohydrate. For this study, this particular study, low carbohydrate diet was, let's see, 28% of their calories. So let's see, on a 1,000 calorie diet, let's say that's 25% of calories. So what is that? Arithmetic. 250 calories by about 4, what is that, like 70 or 80 calories a day. 70 or 80 grams of carbohydrates a day, I'm sorry, assuming you're on a 1,000 calorie diet a day. It's pretty low. If you're on a 2,000 calorie diet, that's 150 grams of carbs a day. So that's their definition of low carb. My definition would be 20%, so that would be pushed down to no more than 100 grams of carbs a day. But anyways, why do you get these different effects? Let's start with the weight loss. So the calorie is not just a calorie. So the effect here is how quickly we digest our calories. So you look at fat, you look at protein, they are digested slowly. They raise the blood sugar slowly. Versus a carbohydrate, you got your breads, pasta, rice, starchy potatoes, stuff like that, they digest quickly, and they raise our blood sugar quickly. All right. So the effect of that is on hormones, mainly insulin. You've heard of insulin before? It's used to get sugar from our bloodstream into our cells. So unfortunately, when we have high carbohydrates in our diet, rice, bread, pasta, stuff like that, we spike our sugar and we spike our insulin. And insulin, unfortunately, makes us hungry. It's a fat-storing hormone. And then we get what's called hypoglycemia. So reactive hypoglycemia. You have too many carbs, your insulin rises, then all that sugar gets sucked up into your cells, and you still have insulin in your blood. So that makes you hungry, and there's too much insulin. So you may find that if you start off the day, for example, with a starchy breakfast, you're hungry soon after, versus like eggs in the morning, which is high in protein, high in a little bit higher in fat, very little carbohydrates. You can have them the same amount of calories, different effect. And to talk about studies in the past that were similar to this one I just talked about. Let's see, who was he? David Ludwig, Dr. Ludwig at Harvard University, did another study similar to this, and he took 3 groups of people. And he fed them breakfast and lunch, each 3 groups. One group got instant oatmeal. The second group got steel-cut oats. The third group got a vegetable omelet. Again, all the same calories, but the calories are coming from different places. So breakfast and lunch, that's what they were fed. And then for dinner, they were allowed to eat whatever the heck they wanted. All right. So it turned out the participants who had the, the instant oatmeal, they ate about 80% more calories at dinner time because they were allowed to eat whatever they wanted at that point. They ate 80% more calories than everybody else. That means they were more hungry. The group who ate the least amount of calories at dinner was, of course, the veggie omelet. They had more protein, they were more full, and they were fuller for longer, too. So that really tells that effect of that insulin spike and that blood sugar spike that we all have. So if you're a bariatric patient, especially a gastric bypass patient, this effect is only amplified. All right, and it's usually amplified through dumping syndrome, which could come in a number of different forms. But yeah, dumping syndrome can be diarrhea, nausea, vomiting, stuff like that to the extreme. But it could be a headache. It could just be the shakes. It could be a queasy feeling. That's dumping syndrome. So you got to look at what you ate before you felt these symptoms, and really go back and assess why you feel like that. But this could also happen to a sleep patient, to a gastric band patient, anybody trying to lose weight. You got to look at where your calories are coming from. So that's a big point I wanted to make today. You could go back and look up this study. Like I said, it's for free. Just search online. I'm sure it's all over the news anyways. But yeah, that's the big point I wanted to make. So I don't know, do we got any questions going on?
Yes, we do.
Yes, we do.
Patient Penny wanted to know, she's trying to get off Diet Coke, and she's having a really hard time drinking water. Do you have any suggestions for her?
Get off Diet Coke. She's having a hard time drinking water. Did she have surgery? Did she have bariatric surgery?
Yes.
Okay.
She had gastric bypass.
All right. Unfortunately, I can't answer that to your personal, habits and all that without knowing more information like a dietitian. There's no easy answer. But what I can do is talk to you about why we want you off carbonation. Soda, diet soda, carbonated water, anything with bubbles in it. All right, it just has to happen when you do bariatric surgery, no matter which surgery, band, sleeve, gastric bypass. So many of you may know this. If you have soda, carbonation, over the months and years of having that, the bubbles stretching on your little pouch, it stretches. All right, over time, the pouch stretches. Eventually, you're going to be eating more calories, larger portions, and your surgery is pretty much done, and you have to get a revision. So straight to the point, don't drink carbonation. If you're having trouble kicking it, all I could say is if it's a sweet thing, there's plenty of options out there for artificial sweeteners. You got Crystal Light, you got Propel, you got 0-calorie Powerade, G2 Gatorade. And these are all artificially sweet, which are perfectly fine to focus on for weight loss. But yeah, unfortunately, carbonation is just non-negotiable. Can't do it. Messes up your surgery. So hopefully that's enough motivation for you to get off the carbonation. All right?
Debbie said that she's having a hard time with solid food and that slider protein is just so much easier for her.
Sure.
She had the Roux-en-Y gastric bypass in February, so she's 6 months out.
Okay, 6 months out, gastric bypass. It's easier to eat slider food than it is solid food for her? Is that her point?
Yes.
Okay. So, yeah, you are correct. It is much easier to eat slider food. So what is slider food? It's just exactly what it sounds like. Food that just falls down really easily. And this is more important for our band and our gastric bypass patients, but it does affect our sleep patients more. As well, also, just not as much. So yeah, slider foods are easy to eat. They're soft, they're squishy. We're talking about yogurt, pudding, like refried beans, very soft. Even chips are slider foods. When you chew them up, they could fall right down really easily. It's just talking about texture, soft texture. So these are easy to digest. They don't cause nausea as much as like solid food. If she's having trouble with like meat and stuff, she may be eating it too quickly, for one. But yeah, so that's what slider food is. Unfortunately, we could eat a whole lot more slider food than we can solid food. For example, let's say we're eating yogurt. You have an unlimited amount of yogurt you can eat. This is a slider food. And I find a lot of our patients after surgery are focusing on yogurt as a daily snack or something. I would not recommend that. Once in a while is fine because this is slider food. And this is why. A limited amount of yogurt. How much of that yogurt do you think you need to eat until you're finally full? All right, and I didn't have surgery. I could probably eat 800 calories of that thing, half a gallon or something of yogurt in order to feel full. I'm going to try that. I'll try that later. But that's just what I think. Maybe 800, 900 calories to feel full of yogurt, soft. So let's compare that to a different texture that is not a slider food. Chicken breast. Very solid, harder to digest. You have to chew it up thoroughly, especially bariatric patients. Maybe 150, 200 calories. If I'm really hungry, 300, 400 calories of chicken. You know, a chicken breast is going to be like 150 calories. So that fills you up quick. It's solid, and it doesn't slide down and stays in your stomach and keeps you full. All right. So usually when people are having trouble tolerating solid food after bariatric surgery, more likely than not, they're eating too quickly. All right. And what is too quickly? Too quickly is not. You have to eat extremely, extremely slow. If you're having like here, a piece of meat like the size of this business card, I probably shouldn't show the name of what this is. So a piece of meat the size of this business card, like chicken or something, it should take you about half an hour to finish this. Some of our gastric bypass patients or sleep patients, even some band patients, are full after about half of this. All right, it should still take you 30 minutes maximum to chew this little bit up. That's how slow you have to eat. So that's one. If you're not tolerating solid food. I think that was part of the question, right? But two, you got to see if it's too dry, it's too spicy, did you drink too soon before your meal? So we always recommend, you can drink right up before your meal, but try not to push. Don't like chug and then start eating right after. So got to look at that too. But more likely than not, if you're not tolerating solid food, you're eating too fast. All right. So put your fork down in between bites. Use baby spoons, use baby forks. That kind of prevents you from eating too quickly. And count 20 times, 30 times before you swallow. Food should be mush by the time you swallow. So hope that answers your question.
Stacy Hill said that every so often I eat a sugar-free, I get a sugar-free mocha frappuccino with non-fat milk and no whip. Is this okay as a treat, a healthier version? Yeah. Or can it be hurting her weight loss-wise?
Sounds delicious. Unfortunately, I don't know the nutrition facts on a skinny mocha, whatever.
It's a sugar-free mocha frappuccino
Sugar-free.
with non-fat milk and no whip.
So I'm going to guess it's obviously better than the non-sugar-free one. So kudos there. It still sounds like a treat. You're not getting much nutrition-wise from that other than caffeine. Probably some fat. It's sugar-free, but is it fat-free? I guess that's, what are we talking about? Starbucks? If you say skinny, they add milk, like skim milk. I don't know if you know about Starbucks at all. I don't go there too often. Yeah, you're going to have to look at the nutrition facts there and budget your calories. If that's something that's hard for you to kick, that is definitely a treat. That's probably not contributing to your protein intake, your vitamin intake, your minerals. You know, definitely not hydration. So you're not getting much from that. So it's a treat. So you got to budget that accordingly. Ideally, none in a perfect world, but you know, you got to live a little. I understand. So look up the nutrition facts, budget it into your habits, make up for it with exercise, which is hard to do, by the way. 100 calories is 1 mile. So I don't know, a skinny mocha, whatever from Starbucks, a few hundred calories, even if it's skinny. So start walking. All right.
And
any other questions?
This is the last one.
Okay.
Debbie said that she broke her kneecap in 3 places, so exercise isn't an option right now. She still has 50 pounds to lose. Had Roux-en-Y gastric bypass about 6 months ago. Do you have any suggestions?
Yeah, so she broke her knee, 6 months out, gastric bypass, and she has 15 pounds more to go. 50. All right. Good news, you're still a rookie as a gastric bypass patient. There's still time. That window of opportunity as a gastric bypass patient is a year. So that's 1. That's good news. 2, diet is more important for weight loss than exercise. We recommend exercise so you don't lose muscle, so you don't lose bone, so you're not feeling weak. It's a malnourishment issue. Of course, more exercise helps. You burn more calories and all that. But your focus is diet now, especially if you have broken knee. That's horrible. Probably very painful too, I'm sure. So nutrition is essential, especially so you heal. As far as weight loss goes, point number 3, you can still exercise. You just don't have to use your knee. You can sit down. You could grab yourself, I don't know, a heavy water bottle, a big can of food, and you know, do bicep curls, do arm exercises, lifting while you're watching TV, for example. That's exercise. As long as you get the heart rate up, you're exercising. All right, and that will definitely help your weight loss as well. But diet is the focus. So yeah, without that exercise, you really have the risk of regaining that weight if you fall off the diet rules. So maybe to kill a little bit more time, let's follow the diet rules. Let's go over that. What do we always recommend to keep it simple? Protein and veggies. Everybody has a very small stomach, unless you're a gastric band patient who hasn't had enough adjustments yet. Make an appointment. Come in for an adjustment. But assuming everybody has your small stomach with the sleeve, the gastric bypass, focus on protein. With a small stomach, you got to fill it up with the right stuff. Avoid the high carbohydrate foods. We were talking about that earlier. Don't want to spike your insulin. That stops weight loss. So other than focusing on protein, try to get 60 grams or more a day is the general recommendation. If you're still hungry, then veggies is the option. Our special rule here in this office, though, if you haven't heard yet, hopefully you should have all heard this, you're only allowed to have protein, nothing else, until you lose 75% of your excess weight loss. So for somebody who's 100 pounds overweight, that's 75 pounds. All right, so who asked that question? So what's her name?
Her name is Debbie.
Oh, Debbie, yeah. So if you haven't hit your 75% yet, you're only allowed to have protein anyways right now. No fruit, no veggies, no grains until you hit that number. You can call the office and we can let you know what that number is. So that's the goal with diet. Once you hit that number, then ideally you add in vegetables into the diet. Once in a while, a fruit. But you should have lost most of your weight by that point. All right. So you can call the office for any other questions. All right. So I guess we're all done with questions. Oh, good. We got 3 viewers now, live, by the way. So I guess I went pretty well. How long did we go here?
20 minutes. You're good.
20 minutes. Sweet. All right. Well, thanks for viewing our second hangout. Hopefully it went well. Just know that this will be up on YouTube. You can view it later. But thanks to our 3 viewers who tuned in live. Next time our goal is 6. So work on that. All right. So friend us on Facebook, Western Bariatric AMC. Find us there. You can go on Google Plus. It's just Google's version of Facebook. Western Bariatric AMC. You can find us there. To follow us with our posts. Kim is always doing some wonderful posts every day. Very inspiring. And then we got some more hangouts on the way. And you can see Jen. She had her first hangout last week, so you can view that on YouTube right now. Okay, so thanks for tuning in. Stay healthy, everybody. Bye. Now, how do you stop this? Stop.